The muscular system is composed of specialized cells called muscle fibers. Their predominant function is contractibility. Muscles attached to bones or internal organs and blood vessels are responsible for movement. Nearly all movement in the body is the result of muscle contraction. Flexion of the elbow requires the contraction of bicep brachii, brachialis, and branchia radialis. It decreases the angle of the joints and brings two bones closer together. Extension. Extension requires the contraction of tricep brachii, and it is the opposite of flexion, wherein extension increases the angle between two bones. Abduction. Abduction of the shoulder requires contraction of the deltoid suprapinatus. Abduction is the movement of the limb away from the midline. Adduction. Adduction requires the contraction of the teres major, coracobrachialis, pectoralis major, and latissimus dorsi. It is the movement of a limb towards the midline. Pronation. Pronation requires the contraction of pronator quadratus and pronator teres. The forearm rotates medially so palm faces posteriorly, making radius and ulna cross each other like an X. Supination. Supination requires the contraction of supinator muscle, making the radius and ulna parallel. Hyperextension. Hyperextension of the neck requires the contraction of splenius, erector spinae, iliocostalis cervices, and trapezius. Apposition. Apposition requires contraction of the opponent's pollicis and opponent's digiti minimi. It is the movement of the thumb to touch the tip of other fingers on the same hand. Rotation. Rotation of the neck requires the contraction of sternonucleodomastoid, which produces the lateral rotation of the head, and longus capitis and longus colli. Circumduction. Circumduction of the arm requires the contraction of pectoralis major, subscapularis, cobracobialis, supraspinatus, and other muscles. It is the combination of flexion, extension, abduction, and adduction. Dorsiflexion. Dorsiflexion requires the contraction of tibialis anterior. It is the lifting of the foot so that the superior surface approaches the shin. Plantar flexion. Plantar flexion requires the contraction of gastrocnemius, soleus, and plantaris. It is the planting of foot towards the sole. Inversion. Inversion requires the contraction of tibialis anterior and tibialis posterior. It is the turning of the sole of foot medially. Eversion. Eversion requires the contraction of the peroneus longus, peroneus brevis, and peroneus tertius. It is the turning of the sole of foot laterally.